Maggie. I'm going to be your nurse today, doing hand hygiene, donning clean gloves. I'm going to close the curtain and door to ensure privacy. Can you tell me your name and date of birth?
Jackie Smith, May 15, 1999.
Banner, do you have any allergies that you're aware of?
No allergies.
What time did you give birth, or when?
It was yesterday about this time.
Okay. And so first I'm going to take your vitals. So
Blood pressure 120/60, heart rate 76, respiration 16, temperature 98.6, and O2 99%.
okay, so your vitals are good, and I'm going to listen to your lung sounds, your heart sounds, and your bowel sounds. Lung sounds are clear and equal bilaterally. No extra hard sounds. Bowel sounds are hypoactive. That's a normal finding for a postpartum patient. When is the last time you had a bowel movement?
I had one yesterday before I came into the hospital.
Okay, and have you been able to pee since birth?
Yeah, I went about an hour ago.
Okay, that's good. We want you going about every 1 or 2 to 3 hours. So next I'm going to assess your breast. So have you had any colostrum yet?
Yeah, I have.
Okay. So that could also help with the nipple tenderness from breastfeeding. Are you breastfeeding?
Yes, I am.
Okay, so I'm feeling your breasts are soft. They're not firm. I don't see any cracking. I see some redness. So we have products that could help with any tenderness or pain you could be feeling. And I see the nipples are everted. Next, I'm going to assess your fundus. So you're 24 hours postpartum, and so I'm feeling that your fundus is about one finger breadth under the umbilicus, and it is firm. It's in the midline, and I don't feel any bladder distension, which is consistent with you having voided an hour ago. So then I'm going to assess your lochia. So I see that your pad has some bleeding on it. It's not a lot, so it's not concerning. It's red. I don't notice any odor. How often do you change it?
I changed it an hour ago when I went to the bathroom.
Okay, so that's an appropriate amount, and I still see some blood on the pad, but that's still an appropriate amount. I'm going to assess your episiotomy for Rita. So I see some redness and edema, but that's normal. And then I don't see any ecchymosis or any abnormal drainage, and it is closed properly. Yeah. And so then I'm going to assess for any hemorrhoids. I would turn the patient over, count how many she had, any characteristics of them, and I would document that. Okay, so next I'm going to change my gloves. Hand hygiene. And done. Clean gloves. Next, I'm going to do the Hogeman sign. So, could you please point your toes up for me and towards you? Do you feel any pain in the back of your calf?
No.
No? Okay. I'm not seeing any redness, any swelling, any heat coming from this leg. What about this one?
No pain.
Okay. Again, I'm not seeing any redness, any edema, any heat coming from that. So, I don't see any signs or blood clot, but if you were to develop any of those, you definitely want to let your doctor know. This patient is rubella immune, so she's good. She is O positive, and her baby is A positive, so she does not need the program. Next, I'm going to assess her emotional state. So, just gonna sit her up. How have you been feeling since giving birth?
Good. I'm really excited to go home, and I'm excited my baby's finally here.
Okay, that's good. Have you been provided any teachings on breastfeeding? Is there any postpartum complications you could possibly have?
Yeah, I've gotten a lot of resources.
Okay, and do you feel comfortable with that? Is there any other teachings you feel you need?
No, I think I'm okay.
And when will you be discharged?
They said maybe tomorrow.
Okay, and you feel ready for that?
Yeah, I'm ready to go home.
Okay, so if there's anything else you need, please let us know. I'm then going to remove my gloves, hand hygiene, and leave.